I just feel like I want to cry. I have spent about 40 minutes doing the surgeon simulator, and I put it up on my editor. I thought, sound gone down. Started playing, and look, why can't you hear my voice? I looks down and my microphone switched off. So I don't know how long it's been switched off. So I'm gonna do this, put this one on YouTube because I know it'll be working. And I've spent having gruesome going why, and my microphone switched off. Oh.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today. A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as,
32.
tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth.
It's heartbreaking, you know, because you're doing the same thing again. Here we go.
Next, position the X-ray cylinder where indicated.
So basically,
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant finish up the rest of the X-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots, and now that all of the X-rays have been completed, we can extract our patient's wisdom tooth.
Brilliant.
The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have 2 or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic.
Brilliant.
To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain the needle may cause.
You know, I'm doing this now, and I'm actually kind of hoping my actual microphone is actually working. Well, I'll do it one more time. If I don't do it again, then, well, wait and see it anyway. It'll be on YouTube anyway. I can't believe it. I've done all this before. Thank you.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
Here we go.
And now we'll give our patient a few minutes to become completely numb.
I wasn't gonna do what I did last time. Started dancing.
Great. The patient's mouth is numb, and now we can move on to removing the wisdom tooth.
Yay.
First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
I've done all this before, so brace yourselves, people. Oh.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
Get the hammer. Oh, the creaking.
Now clean the area using a surgical suction. This will allow us to check the area for any bony matter or tooth.
Oh, yes, we're water. I'm just done there. Oh, tongue's blowing.
Everything looks great,
I just realised.
but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
Yep, I remember that. I don't know if like 2 minute release.
Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth.
Yep.
When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity. Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days, avoiding sodas and the use of a straw, and gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours.
I never got told that.
It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area. And that's a wisdom tooth extraction. You did great. If you're up to it, why not try another procedure on surgerysquad.com.
That was one of them I'm going to play. Then I played the gallbladder surgery, but I'm actually going to do something different. So, and gallbladder were nasty, but it's not actually good enough. I'll add the gruesome ones, me. I don't know what that is. I think that's your thing, but ain't your punch bag at the back of your mouth. But we'll go for this one. We'll go for this one. Here we go. Oh God! Please, not Dr. Seuss there. Oh.
Hello, and welcome to Surgery Squad's virtual
Jeff the
colonoscopy.
Killer.
I'm Dr. Jeff,
Hi,
and
Jeff.
I will be guiding you through this colon today. Also known as the large intestine, the colon is responsible for the final stages of the digestion.
Oh.
It absorbs remaining water and electrolytes from indigestible food, accepts and stores food remains that weren't digested in the small intestine, and eliminates solid waste from the body. A colonoscopy allows your doctor to view inside your entire colon using a device called an endoscope. As the scope moves into your colon, your doctor views the output on a monitor to check for growths or polyps. There are several parts to the colon: the cecum ascending, the transverse, the descending, and the sigmoid. A colonoscopy can check each one of these areas. The one thing about having a colonoscopy is that a doctor can find polyps and remove them immediately. This is the most effective way to prevent the development of colorectal cancer. However, you'll need to cleanse your colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding. Plus, you'll need to be sedated during the exam, which should take about 30 minutes or longer if any polyps are found. We have a 53-year-old female waiting for her colonoscopy. Let's get scrubbed and take care of this.
Yeah.
Our patient is lying on her left side, knees drawn up to her stomach. She's wearing a gown, and we have a sheet draped over her. Let's set her up with an IV drip of the sedative.
I just didn't know what this was, so brace yourself, people. Oh, it's one of them things about goes in you to make you fall asleep. Oh, I got full view of that. Oh, and then great, yeah.
Great. Now we'll wait a few minutes for the sedative to take effect. Our patient is sedated and ready. She stated that she's cleansed her colon, and I've already used a lubricated, gloved finger to check for blockage. Be sure to tell the patient that she should breathe slowly through her mouth to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find. First, let's lubricate the scope for easy insertion and passage through the colon.
I will put a thing of viewers' aggression. I didn't realise it was like this.
Carefully insert the scope into the patient's anus and slowly move it into the colon. We can watch the camera's output on the monitor. We're into the rectum now. Nothing so far. Let's move on into the sigmoid colon. Slow and steady. You're doing a great job. Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam.
I'm speechless.
All right, let's move into the transverse colon. Uh-oh, looks like we've got a small polyp in the transverse colon. We'll use the forceps to remove it.
Yeah, let's do this thing. Plop. Nope.
Fine work. We'll need to remove the scope so we can bring the polyp out. First, let's use some heat to cauterize the spot and try to stop that bleeding. Fantastic. Let's slowly withdraw our scope and get that polyp out.
Reverse, back out.
Let's go back in to check the rest of her colon.
For God's sake. I thought we were
Remember the name of the colon where we found the polyp?
Yep.
That's right, the transverse colon.
Yeah, quiet, let's go forward, let's get in there. I thought it was something to do with the back of your throat. Oh my god, this is nasty. I think she's fine!
Back in the transverse colon now. Everything's looking fine, and you're doing a great job. Now's also a good time to remind our patient to breathe through her mouth slowly. Moving now into the ascending colon. And there's another one. Let's take it out the same way we did the other.
Sorry. I'm so sorry, love.
Back in the ascending colon now, and we move into the cecum. And all looks good. Let's take out the scope and get our patient into a recovery room. Our patient is now in recovery, and she'll probably be there 1 to 2 hours. She might feel bloated or need to pass gas. And since we removed 2 polyps, she'll probably have a small amount of blood in her stool. We'll also do a biopsy on the polyps. She should call her doctor immediately if she has heavy rectal bleeding, lower abdominal pain, develops a fever, feels dizzy, vomits, or experiences swelling in her abdomen. Well, good news. The biopsy showed our patient's polyps were benign. Since she's in her 50s and there were polyps found, she should have a colonoscopy every year. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Surgery tell Susie, Dr. Susie, surgery was fat on our patient. No, we're not going to do that. I do apologise and that I will put of viewers' discretion advised. Weird one. I hope it's not as bad as the last one. Visual gastric bypass surgery. No idea. I'm just stepping into it and just pray for the best.
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr.
Hi.
Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes. Our patient has been prepared for the procedure with a mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland. From here, we'll place an endotracheal tube down the patient's throat.
Oh.
You're up. See if you can get the tube into place.
I like that, mate. You're up. I wish there were a thing you could scavenge your voice, because the first video went like nice and easy. I did tonsil surgery, and I did the first surgery I did that one on the first video, and what else did I do? I did 3. I did 3 or 4. I did 3. I did hair transplant, tonsillitis surgery, and teeth one. But here we go.
Great work. This tube is then connected to a respirator. The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide the scalpel in where I have marked to make the incisions. Be careful, these are small incisions. Don't get carried away.
Don't get carried away.
Nice technique. You must have an excellent teacher. Oh wait, that's me.
Oh, shut up.
Next, we'll place a device called a trocar into each incision.
No idea what the hell that were. Felt like water dripping. No one behind me? No, I'm fine. I'm alright. Perf! 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 Perf.
These devices allow us to easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on. Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide. Let's face it, with a newbie helping out, we'll need all the room we can get.
With a
Time
newbie.
to start the
F
gastric
you.
bypass.
F
We'll use
you.
this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg.
It could have said learner.
We do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch. We'll now separate the small intestine from the old stomach, about 2 feet down. The lower part of the intestine will be connected to the new, smaller stomach, with a half-inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device
I have
to
no idea
create
where
a
the 405
half-inch
is.
opening where indicated in the new stomach pouch. Now, drag the loose end of the intestine to the new stomach pouch to attach it.
What?
I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated. Again, I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars. Now we need to suture each of the incision.
See, I'm a surgeon.
Nice work. I bet that won't even leave a scar. Now our patient goes off to recovery. In most cases, they'll spend a few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery at surgerysquad.com?
I've never done that. Oh, I did that. I thought that looks like a back of your mouth, you see, that's the problem. Done that one, done this one. I'll do one more. One more. This looks awesome. Eye surgery. Let's do this thing. I think it's Dr. Souza, if I remember.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today.
Hi.
LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved.
Yay!
Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
I mean, how can drops numb your eye? Just like water. Ugh.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean.
I didn't do that.
Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum over the eye.
I think these actually kinda, you know, like the A10ones.com, so similarity, you do a lot more. I think actually these are tutorial videos, how they do it. I might do it to young and, you know, and video it. Yeah, I'll do eye surgery on my little sister.
If the patient was allowed to blink, we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring.
Is it a snap-on blade?
We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea. With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea. This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair.
59.9 seconds.
And that's it. Please fold the corneal flap back into the... Nicely done.
Yeah.
While you were working, I went ahead and took care of the other eye.
Bitch!
We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home, as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my
Yeah,
other
that's what I did.
procedures here on surgerysquad.com.
Roll them bones. That's what I did on the last video. What failed because of my voice. But I'm gonna leave this episode here. And actually don't know when I'm actually going to do some next surgery videos. I might do some later along down the week or probably next week or something. So I want to get more stuff done, like flash games, serious games, and you know, basically stuff like that. So I hope you're enjoying this journey. I mean, I seriously hope. I'm sorry about the last one. I mean, not last one, the column. I thought it was something to do down your throat or something. I don't know. Like I say, thank you all for watching. I've clicked the message for surgery videos I've done, and I will see you in the next episode. Bye bye. And remember, don't try this at home.